Hey there, welcome back to our channel. In today's video, we're going to explore what happens to your body when you intermittent fast for 30 days. Intermittent fasting is a popular health trend that involves alternating periods of fasting and eating. There are several types of intermittent fasting, but today we're going to focus on a 30-day challenge. We'll be diving deep into the science behind intermittent fasting and discussing the effects it has on your body. As always, you should consult with a healthcare professional or nutritionist for personalized advice and guidance. What is intermittent fasting? Intermittent fasting is an eating pattern that involves cycling between periods of eating and periods of fasting. It's a popular health trend that has been around for centuries and has gained popularity in recent years due to its potential health benefits. There are several types of intermittent fasting, but the most common include the 16-8 method, where you fast for 16 hours and eat within an 8-hour window, and the 5-2 method, where you eat normally for 5 days a week and limit your calorie intake to 500 to 600 calories on the other 2 days. Intermittent fasting can be beneficial for weight loss and overall health, as it helps to reduce calorie intake and improve metabolic health. By reducing the number of calories consumed, it can help to create a calorie deficit, which can lead to weight loss. Additionally, intermittent fasting can improve insulin sensitivity, reduce inflammation, and lower the risk of chronic diseases like cancer and heart disease. When you fast, your body enters a state of ketosis, where it starts to burn stored fat for energy. During this process, your body produces ketones, which are used for energy instead of glucose. This can lead to a decrease in body fat and an increase in lean muscle mass. Intermittent fasting can be challenging at first, but it can become easier with time as your body adjusts to the new eating pattern. It is important to stay hydrated during the fasting period by drinking plenty of water and other calorie-free beverages like tea and coffee. The effects of intermittent fasting on your body. Intermittent fasting has several potential health benefits for your body. These include weight loss, improved insulin sensitivity, and decreased inflammation. Weight loss. Intermittent fasting can help to create a calorie deficit, which can lead to weight loss. When you fast, your body burns stored fat for energy instead of glucose. This can lead to a decrease in body fat and an increase in lean muscle mass. Insulin sensitivity. Intermittent fasting can improve insulin sensitivity, which is the body's ability to use insulin efficiently. This can reduce the risk of developing type 2 diabetes and other metabolic disorders. Inflammation. Intermittent fasting can also decrease inflammation in the body, which is a key factor in the development of chronic diseases like cancer and heart disease. By reducing inflammation, intermittent fasting can help to improve overall health and longevity. Intermittent fasting may also have other potential benefits, including improved brain function, increased longevity, and reduced risk of cancer. However, more research is needed to fully understand these effects. The 30-day challenge timeline. So, what happens to your body when you intermittent fast for 30 days? Here's a more detailed timeline of the changes you can expect. Day 1 to 2. During the first day or two of the challenge, you may experience hunger pangs and cravings as your body adjusts to the new eating pattern. This is normal and should subside after a few days. Day 3 to 5. By day 3, your body is starting to adjust to the fasting periods. You may experience increased mental clarity and focus as your body begins to burn stored fat for energy. By day 5, your body is fully adjusting to the new eating pattern, and you may experience fewer hunger pangs and cravings. Day 6 to 7. By the end of the first week, you'll start to see some initial changes in your body. You may notice a decrease in body weight due to water weight loss, but this is not true fat loss. Your body is just adjusting to the new eating pattern. Day 8 to 14. By the second week, your body has adapted to the new eating pattern, and you may start to see significant changes in your body composition. You may notice a decrease in body fat and an increase in muscle mass, as your body starts to burn stored fat for energy. Day 15 to 21. By the third week, you'll start to see more significant changes in your body. You may notice that your clothes fit better, and you have more energy throughout the day. You may also experience fewer hunger pangs and cravings as your body continues to adjust to the new eating pattern. Day 22 to 28. By the fourth week, you'll start to notice the full benefits of the 30-day intermittent fasting challenge. You may notice a significant decrease in body fat and an increase in lean muscle mass. You may also experience improved mental clarity and focus as your body continues to burn stored fat for energy. Day 29 to 30. By the final 2 days of the challenge, you'll have developed healthier eating habits and improved your overall health. You may notice that you're more mindful of what you're eating and when you're eating it. If you're happy with the results, you may want to continue with intermittent fasting or make it a regular part of your lifestyle. Keep in mind that everyone's body is different, so the changes you experience may vary. It's important to listen to your body and make adjustments as needed. If you're feeling unwell or experiencing any adverse effects, stop the challenge and consult a doctor. Overall, the 30-day intermittent fasting challenge can provide several benefits for your body, including weight loss, improved insulin sensitivity, and decreased inflammation. By cycling between periods of eating and fasting, you can create a calorie deficit and improve metabolic health. Remember to start slowly, stay hydrated, plan your meals, listen to your body, and be patient when taking on the challenge. With persistence and consistency, you can achieve your health and wellness goals with intermittent fasting. Tips for a successful 30-day challenge. If you're planning to take on the 30-day intermittent fasting challenge, here are some tips to help you succeed. Start slowly. If you're new to intermittent fasting, start with a shorter fasting period and gradually increase the duration. This can help your body adjust to the new eating pattern and reduce the risk of adverse effects like dizziness and fatigue. Stay hydrated. Drinking plenty of water is essential during the fasting period to keep you hydrated and reduce hunger pangs. You can also drink other calorie-free beverages like tea and coffee to help curb cravings. Plan your meals. Planning your meals in advance can help ensure you're getting enough nutrients and calories during the eating window. Make sure to include plenty of fruits, vegetables, lean proteins, and healthy fats in your meals. Listen to your body. If you're feeling unwell or experiencing any adverse effects, stop the challenge and consult a doctor. Stay busy. Keeping yourself occupied during the fasting period can help distract you from hunger and reduce the risk of snacking. Try going for a walk, reading a book, or doing a hobby that you enjoy. Be flexible. Intermittent fasting can be adjusted to fit your lifestyle and preferences. You can choose a fasting schedule that works best for you and modify it as needed. Don't overeat. While it may be tempting to eat large meals during the eating window, it's important to avoid overeating. Consuming too many calories can negate the effects of intermittent fasting and lead to weight gain. Be patient. Intermittent fasting can take time to show results, so it's important to be patient and persistent. Stick to the fasting schedule and healthy eating habits, and the benefits will eventually follow. Intermittent fasting is a popular health trend that can provide several benefits for your body, including weight loss, improved insulin sensitivity, and decreased inflammation. By cycling between periods of eating and fasting, you can create a calorie deficit and improve metabolic health. However, it is important to start slowly, stay hydrated, plan your meals, listen to your body, and be patient when taking on the 30-day challenge. Remember that intermittent fasting is not a one-size-fits-all approach, so it may take some trial and error to find a schedule that works best for you. If you're interested in intermittent fasting, consult with a healthcare professional to determine if it's right for you. Thanks for watching, and don't forget to subscribe to our channel for more health and wellness videos.